I think we're going to do an interesting topic today. I have a bit of a cough too, so I apologize if I get a little bit of coughing fit while we're doing this presentation. Um, but this coping with emotional impact of adverse patient outcomes, I found that to be a really interesting topic. I, would be lying to say that I had a huge amount of knowledge about that prior to kind of doing some research into it, and just doing that, just found out like the mass complications that come with a physician when they're dealing with something that goes, awry when they're trying to help and work with patients. This, I think we'll hopefully talk about, the points that are really important to cover within these 40 minutes of a presentation about this topic. Get the slides rolling. There we go. So you get to the objectives of today, or just kind of discuss the challenges of adverse outcomes. Look at the emotional impact it has on physicians, and discuss, the coping strategies to kind of deal with this stuff. So in doing that, we're going to do some videos and then kind of show some statistics. And I think that's where I'll probably start off with, is just kind of showing some statistics about how relevant or how prevalent this this issue is. So in doing some of this and reading some articles, so one of the things that really stuck out to me was that it's estimated about 90% of physicians at some point throughout their career is going to have an experience that's going to deal with either a near miss or some serious error in treating and helping their patients. And I think that, nearly everybody is going to have some point where they're going to have a situation where something almost happened bad or did, and they have to deal with it. In fact, the next number says almost half the people do have to deal with something that is serious, that had a serious outcome that's going to have an impact on their career. And that's really difficult, because one of the things that was like talking about when we look at the statistics is, we have this expectation when we go see physicians that they're going to help us deal with whatever the problem or the issue is. And the reality is that medicine's not a perfect science. Physicians are well trained, well educated, are people that are committed to doing the right thing and helping others. But there's no way universally that it's going to be a perfect scenario every single time. There's no way to prevent the potential of a bad outcome, not even with the advances in technology and the tools available, that is, despite best efforts, something could bad happen, or something bad can happen. And I think that's what that statistic really rung out to me, is that almost everybody's going to have a chance where they either almost had that bad thing happen or did have that bad thing happen. And what happens to a physician when that happens, and not just in the sense of in the clinical setting that it happened in, and the environment, whatever the potential concerns or consequences happen there, or even legal issues, which we'll talk about, later on in this presentation. But just the emotional impact of this, and that to me was the really big one that stuck out. There was a lot of interesting information that I kind of just, saw about or learned about, how to deal with, and the impact it has on a physician when, something bad does occur. So these are some additional statistics that, I found in doing some of the work for this presentation. And there's a survey done in 2008 on residents. I think the number was close to 1,100 residents were surveyed, in their first, couple, 2 to 4 years of practicing medicine. And I think these statistics are really amazing. It's 45% of them had some personal involvement in a serious issue. That means before their career is kind of fully taken off, that they've already, most people, 45%, almost half the people have had dealt with a serious error. And 34% of them, it had to disclose the serious error to the patient, and 63 had to deal with disclose a minor error. But this is, I think, the number that was really startling with this, is that only 33% of them had ever received education or training on how to deal with, addressing this with the patients. And we'll talk about that a little bit later on, about, how important that consent and rapport with the clients is prior to getting into, if it's a procedure or some sort of thing that, event that you have to deal with, that knowing how to be able to have a rapport and be able to disclose and to share and help people and and be able to do it for yourself to be able to stay sane. I thought that was crazy that it was only 33% that had received it. And it obviously I wasn't alone in that thought, because it said 92% wanted new or more information in learning how to deal with an error disclosure, because how prevalent it is, how impactful it is, not only to the physician, but to the family, to the system. Um, in that training is vital, and yet only a third of people are getting it. So I thought, wow, that's, before things even get started, most people have already had experience it, and not a lot have known how to had training. It's like almost you have to get on the job and learn from others to know how to handle a situation like that. And of course, there's these tangible challenges of dealing with adverse outcomes, right? Things like lawsuits, having medical reviews, internal disciplinary action, regulatory action, and the hit on the reputation. I think all these things are really challenging, because each one of them has, this is what I learned about doing these the emotional impact of an adverse patient outcome. It's not only just the feeling of what happened and what happened with that patient, which is, I think, the most human part of that experience. But then when other things start occurring, either internally with the hospital system or the healthcare system or the clinic, the office setting, it's also what happened, there's the emotional feelings that come with that, with your peers, the emotional feelings that come with, like, if you say you do get a suit, that come with that, the anger, the frustration, how a regulatory board might respond to something like that, and I think when we get back to that, one of those first slides is that sometimes even with our best efforts, sometimes bad things happen, and yet sometimes we get treated as if we're negligent. And not that there are times where that may have occurred, but many of the times when people do something, they were doing everything in the best billing practice they have, and just sometimes errors happen. And so while we look and try to create a system where that it could be perfect, we just know right now that there's a human element that occasionally that does occur. And I think that not only was it talking about like dealing with kind of how outside entities are approaching it and how they shame or make people feel bad, that connects with that professional reputation. You get that kind of hit on your status as a professional. Sometimes it's very difficult to figure out ways to recover. And I've worked with people that know that they've had instances that happen, 15, 20 years ago that got resolved, and it's still stuff that people can find out and look up for, and still that hangs over their career, decades later. And so when we talk about that emotional impact, and I think these connect with obviously all the, all the scenarios, is right. You go through all the emotional, gauntlet of feelings: blame, shock, guilt, shame, anger, failure, depression. I think the big one that we talk about is when we get into this, and the emotional impact of how this has on people's careers, and looking at, why it's, the way we cope with stuff and what we're trying to reestablish when we're coping with these kind of emotional experiences, the feelings of inadequacy and loss of confidence. I think a lot of times, because of all of the external response that does sometimes happen when a negative outcome occurs, it challenges, who we are as a core, as a professional, in helping others and learning how to regain a sense of confidence in adequacy is critical, because there's so much sometimes baggage that can come with that it's hard not to feel like, well, maybe I'm not as good as this. And especially difficult for physicians who have been typically been proud of their consistency towards being the best, or being perfectionist, or being able to handle difficult situations, and have something that kind of can knock the wind out the sails. It's very difficult sometimes to recover from. And so, again, continuing on some of the emotional impact is, right, when we talk about this, it is a real thing that when you witness somebody else experience a traumatic thing, or being traumatized by somebody else's trauma, I mean, that can have a serious impact. That is the kind of stuff that can lead to, as it shares on the screen, having secondary PTSD, or even having that survivor's guilt. I mean, we don't always have to be the person that the trauma directly has happened to experience the negative effects of it. And I think most of us know that, but I think sometimes we forget about it in the hospital setting or the clinic setting, because it's our job to help others, and we got to keep on working and stuff like that, and not stop sometimes saying sometimes certain cases, really hit us, and we can take a lot of emotional toll or feel traumatized by what happened. And of course, we're going to have the more intense or feelings and reactions towards those that that we identify or connect with more, or that we perceive that we sometimes see ourselves in, or can empathize because of our own personal experiences that that can have a real difficult and strong toll on us. And it kind of shared too with some of the research we had that OBGYN specialty tends to have more vulnerable for this. And I think maybe I'm probably given to is the fact that we're dealing with children and people. Most people have experienced having that in their lives, or somebody, or having kids that they care for at some point, and it can feel more vulnerable, in that scenario. Or I probably said that wrong. But dealing with such a fragile, situation, talking with infants and stuff. And so we also want to talk a little bit about the second victim. I thought that was an interesting term, and that was one of the things when I was starting the research for this, and I was talking with Kate, was kind of that term that came up as being the second victim. We got the initial victim of the scenario, which is the patient, and obviously the people that are impacted by a patient that has had a negative experience from something bad happening to them, that they're still alive and having to deal with the consequences of that, or even the negative impact of something like a loss of a life in the family. But we also, as healthcare providers, experience that loss too. And I think that's really important, that to recognize that we can be victimized by things that don't go right, especially when we're doing our best to try to help and to serve others and kind of give them the support they need, and something doesn't go the way that we're planning it very unexpectedly. And it can be a major life and career changer. I mean, something negative like that happening can put somebody on a different trajectory altogether. It can affect their life and their sense of well-being, both in an emotional, physical sense, and it can affect their career. By the damage it's done, or B, by the loss of confidence and ability to feel that they can continue to perform at the high level that they've been performing before, because they will they question themselves and have a lot of doubt about maybe being able to be the professional that they thought they were. And so and these are potentially permanent consequences. Now, sometimes an event like that can sometimes, even though negative, can give a person the opportunity to, that second victim, the opportunity to grow from it and become a better physician. And that's kind of what we're going to talk about later in the presentation when we talk about the coping skills. But a lot of times, unfortunately, the physicians aren't great at sometimes reaching out and asking for help. And there's a little bit of the term code of silence sometimes that occurs in some of the literature I was reading, that they don't talk about that kind of stuff, and the consequences of it don't tend to be the things that they took a bad thing and made it good, but sometimes take a bad thing and then by not being able to deal with it or cope with it well, make it worse. And so that's really what we're talking about, when not getting trapped, so we don't experience having a bad thing and making that situation even worse for ourselves and all the facets of our lives. So this was an interesting video I found, or I think actually Kate shared it with me, and that I thought was really good. It talks about being a second victim scenario and kind of the devastation of that can have on somebody's personal life. Now this video speaks to a nurse that had a negative experience, but I think that we can identify just as healthcare providers and put ourselves into that the scenario well and kind of empathize. So it's a little longer. It's probably about 5 or 6 minutes, but I think it's a good, worthwhile watch.
My name is Sidney Decker. I am a professor at Griffith University. Let me tell you about a nurse. She was a long-time practitioner in a children's hospital. And then one day, a patient of hers dies of a calcium chloride overdose. The nurse is blamed, suspended, then fired. Her license to practice is revoked. Afterwards, she reportedly cried for weeks. A carer and a healer at heart, she not only lost a job, a livelihood, she lost an identity. Her psychological health deteriorated. She became increasingly depressed and isolated. And then 7 months after the patient's death, she killed herself. Now the patient, the child, and its family, in this case, would be the first victim. The second victim is the nurse. Second victims are practitioners who are involved in an incident that harms or kills somebody else or has the potential to do so, for which they feel personally responsible. Second victims are not limited to healthcare. I've met second victims in air traffic control, in airliner cockpits, in process control plants, in the police, in firefighting. And two things tend to set them apart. One is trauma-like symptoms. These include hyperarousal, re-experiencing phenomena such as dreams, intrusive thoughts, flashbacks, and avoidance behavior associated with the situation that made them into a second victim. And then they typically have feelings of intense guilt. Even if they themselves are capable of pointing to all the factors in the situation that contributed to the bad outcome, they will still feel guilt because they are responsible practitioners and because somebody else put their trust in them. Now, things don't have to go badly for the second victim. I know of 2 pilots involved in a large accident that killed over 80 people. And through the pain and the trauma and them losing their jobs and being criminally prosecuted in a foreign country, these pilots are flying today and with another carrier and thriving. Interestingly, the intensity and severity of the outcome is a very bad predictor of how things might go for the second victim. I know of another pilot involved in a pretty bad accident, not of his own making. All 129 occupants of that airplane basically walked away. He did too, but he never flew again. The main determinant for how things go for a second victim is community, is social support. The mother of the nurse who committed suicide later commented that her daughter had run out of coping skills. But I wonder, was it the daughter who ran out of coping skills, or was it the community that loaded too much onto her shoulders to cope with? Was it the community that offered too little support in carrying the load? How an organization, how a community deals with a second victim says a lot about how they view safety generally. If they dismiss a second victim, if they push the second victim out of view, then that signals fear, anxiety, denial, a lack of a willingness to learn from failure. In that sense, I believe there is a very important link between the resilience of a second victim and the resilience of the organization. So what should we do? As an organization, you want to make sure, first of all, that you have mechanisms in place for psychological first aid. That is, after an incident, be able to take the second victim off shift and make sure that they can recover to a level of psychological and physiological functioning that is relatively normal. Then empower the second victim. Make sure that you debrief them extensively on what may come next, on what their rights and duties may be in the wake of the incident. If they want to, you may even want to involve them in the investigation. Rather than them becoming a passive recipient of the end result of the investigation, you can make them an active participant and contributor, because they too will often be acutely interested in finding out how things could go so wrong. And finally, you may want to think about organizing or facilitating an encounter between first and second victim, but only if both are ready for that. Now, it may be a good idea to have such processes run by peers, those who do the work of the second victim, who know intimately its messy details, and not managers who, after all, can create career jeopardy for the second victim. And finally, Make sure you don't automatically medicalize or pathologize second victims. They feel what they feel, they suffer what they suffer, not because they are sick, but because they're human, like you and I.
So hopefully that was a, excuse me, impactful video. I think that was, they really talked a lot about things that are important to consider when we're talking about being the second victim and having these, negative experiences. It talked about the nurse and, the end result of her unfortunately taking her life. And I think one of the things that really brought out was how ostracized that person was, how isolated they became, and how the surrounding entities kind of respond to the situation. And when somebody's in challenged and in trouble and they start isolating, that's usually when we see, bad things happen. I mean, it's one of the challenges that we face, even with like the addiction problem that we have in the state, where people need help. But typically, what happens when they're struggling with this illness is that they get in trouble, they get legal school, whatever, and they get isolated from positive. And so that's what happens when in a situation somebody gets in trouble at work, a bad situation happens, a negative outcome, and instead of trying to embrace, sometimes that person gets ostracized, they get punished, by the work environment, the regulatory board. There's the maybe legal stuff, and then they have to carry their own emotional baggage towards that, and that's a lot. And so one of the things it talks about when these things happen that was important is how do we involve that person, if something bad happens, how can we, participate in the solution to solving that issue, so we can stop a reoccurrence from happening, and empower that person to be able to find confidence in themselves again. Because again, most of the time when these things occur, people are trying to use their best judgment, best practices, and the tools they have available, and yet because it's not a perfect science, sometimes bad things happen. So how do we find ways to be able to help people when they experience that bad thing, be able to get back so they can start helping, continue to help, because the majority of the time they are being successful in helping people, and so, there's this, I found this 5 rights of the second victim, and I thought these are good, is that, they get treated justly. There's not a presumption of guilt or negligence. That the idea is when a person has it, it's not, we don't just immediately go and do the blame, is that we assume that the person was trying their best, and there obviously the things will be analyzed and looked at, but this initial thing is that we have to assume that people, so they don't already immediately get told how terrible, and because that starts that negative spiral that people start internalizing. Respect, don't blame, don't shame. Try to treat the person with respect. It's a difficult. It's obviously these are difficult situations for multiple people, but this person particularly is somebody that in most cases was doing the best they could help, and the negative thing happened under their watch, and it's important for them to feel like it was good that, they're trying to help, and we'll look into this scenario, but they don't want to lose the ability to continue to help other people, on be understanding, compassionate, getting supportive care, which we'll talk a little bit more about that, and then, and how the transparency and opportunity can contribute. Smelling there, that idea, like he was talking about at the end of that video, is have them be part of the solution to make sure that something like the negative adverse outcome doesn't occur again. So the question is, how do you cope when you deal with something, right? As it was stated in the video and then the last page, seek support, peers, family, and then I think probably really importantly, professional help that, kind of, giving you kind of that a neutral perspective on this thing, so you can really process the internal emotional, roller coaster that you're going through on the scenario. Maintain balance. We talk about that through a lot of the videos when we're talking about time management, or we're talking about stress and burnout, all those kind of things. So it comes back to maintaining balance, keeping your schedule in place, not letting one slip the other. I think that's the response sometimes people have, is when they have such a negative experience that either go really far to like they overgo into work because they're going to try to fix this and try to make everything right and do it, and they lose themselves into their own personal self, who they are, or they start pulling back and isolating from work and running away from that thing because they're fearful, or their confidence has been shattered a bit. Help restore mastery and self-esteem. I mean, it's huge, important to be able to help build somebody back up so they continue to be able to help others and change the meaning of the event. We talked about that again. There are consequences that happen when there's an adverse outcome, but sometimes it's how we respond to that adverse experience really matters. And how can I take something that it was negative and find a way to turn it into a positive, in the sense of being able to help grow from that experience in multiple levels, personal, professional, and being able to become even a better helper to others. I thought there's an interesting quote: bad outcomes do occur when good doctors practice good medicine, and there is no negligence. It just sometimes happens. And one of the things that was interesting too, in the same kind of article I got that quote from, is talk about litigation is more about compensation and not competence. A lot of times when people are making a lawsuit or something like that, they're trying to gain something because they lost something, and it's not necessarily always a reflection of the person's competence. It's more sometimes that the people that have experienced a loss, they're trying to just gain something back, and this is one of the ways that they're dealing with how to cope with it. It sometimes has nothing to do about the competence of a professional, because a lot of times in cases there could be things where the person did everything they could and just the bad thing occurred. There was no negligence, no people choosing the best judgment, and just something didn't go the way it was expected. And I think I found this this information I thought was interesting. Why is a liability suit so stressful and these adverse? And I thought this was interesting because it talks about the emotional impact of how these a liability suit could impact somebody. Right? It challenges your sense of being knowledgeable and in control. It challenges the sense of conscientiousness and caring and confidence. It charges as listed, it assaults your self-esteem, sense of honor, your reputation, feelings of guilt, self-accusation, fear about the repercussions, that loss of trust. I thought this was one of the ones that really stuck out to me when I saw this list. It says, this idea, a doctor was quoted saying, I don't think you ever look at patients in the same way. And I thought, well, that might be really true. If you're failing, you have a situation where you had an adverse outcome and then somebody took action on that. And, every time you're trying to help somebody, if something goes wrong, is this going to be the thing? And you'd be doing your best effort. And it's like, here I am trying to help, and I'm getting, these really big consequences. And it's not that people don't understand why people respond when something unexpected happens, but it makes you kind of like, it can get people in that place of doubt and second questioning. And it challenges that judgment and skill, and causes us to question ourselves that may last a long time. These aren't, I think one of the things we don't think about when we talk, and this goes back to when we talk about the trauma. People that experience trauma, that the stuff doesn't just like, it was there and it bugged me for a couple of days, and it goes, it's something that impacts people. We know that there's sometimes we see how trauma is so sufficient that it can affect us to have like PTSD or have survivor's guilt, that stuff gets ingrained in the brain, and it's there, and it has to be dealt with in a concrete professional sense, to not let it dictate how we respond and behave to scenarios, because we don't want to lose people that are out there trying to help save and help people's well-being and lives to stop doing it because life unfortunately has times where even our best efforts, something goes wrong. As a colleague, how can you help in a scenario like this? I think the things that we mostly know and understand: express sympathy, listen, ask how you can be involved, where you can help, look for the signs of distress, depression, things like that. People are disconnecting, isolating, not as engaged as they used to be. We know when somebody's just a little off, and I think that's when we're kind of saying, look for those things and, ask, talk to people and listen. I think that's a really important one. a lot of times I think it's important to encourage, but I think it's also really important and much more important to listen. I mean, I know that as my profession is that people come in because they sometimes don't feel like anybody's listening to them, and sometimes just being there is a help beyond stuff that people have experienced before, just being heard. Check if they have any external support. I think that's been repeated and repeated and repeated. It's like this idea that we need people around us to not isolate and that when we're in a high stress and high emotional place that's unhealthy is terrible for us. So, make sure there's people around us, and don't promote the code of silence. Make sure people can talk, make sure people feel like they are okay. When you're checking with people, make sure the language is one where they're not making them feel, feeding into that self-doubt or self-confidence, we're using, ways to encourage and help people move forward from it, and be there to talk about it. I think that's another thing I don't think it's just physicians. I think a lot of healthcare professionals struggle with knowing how to share themselves when there's challenges, and, we should have the answers, and that's just not true. We're people, we all have kind of professional skills that we can help others, and those are important. We also are people that are vulnerable to all the emotional experiences that anybody else has during times of challenges. When do you seek help? Obviously when your behaviors and stress start affecting your work and relationships, when it's a preoccupying thought in our heads, I think that's a big one. I mean, that's usually how we know something's an issue, when we can't seem to shake it. It's just there, and it's there. We never notice a time when it's not on the forefront of our thoughts, and it affects how we're responding and behaving. I think it makes us second guess stuff that we should be able to kind of deal with naturally. Obviously using substances can be a sign of people struggling from the results of an adverse outcome. If your family peers are seeing the changes and making comments, that's obviously, when others see it, it's usually a time to know we change. If anybody knows the Johari window, and we have these open, secret, blind, and subconscious window panes. Oftentimes when we're struggling and not being open, our secret window pane is much bigger and our blind window pane is much bigger, meaning that a lot of people see behaviors that we think we're keeping secret, but because our behaviors aren't consistent with what we're saying, like I'm fine, but everything we're actually not looking fine. People say things and they start saying stuff to us to try to help us become aware of things that we think we're dealing with well, and we're not always dealing with it well. And of course, dissatisfaction in the work. I mean, that's a huge one. Like, we have this negative outcome and it causes us to be dissatisfied, and started getting those symptoms of burnout where I don't want to come back and don't want to do this and don't feel like I'm contributing. Those are really places where the help is needed, so we don't lose the physician to an unfortunate event. How do you deal with it? Cope with it professionally, right? Make sure you educate yourself, participate in peer review and root cause analysis. Be part of that. Work on an informed consent. Have frank, open discussions with the with the patients about the potential risk, especially when they're going into something that has there is a big risk for a negative outcome or a potential for a negative outcome. Good documentation. I mean, that's going to help with the legality component of it, and then communicate. Develop rapport with people, and the client and their family, so they know whatever happens that there was a human element to this experience and in trying to help others. I have one little video, and then we'll get there. I know I see Caitlin came back on, so I'm getting close to the end. I'll show this one that's couple-minute video, and then we'll kind of go into a couple minutes for any questions or just discussion about the topic. Oops. Whoops, my bad. There we go. Where is it?
Parking lot has garnered more than 2,500 comments on Reddit in just the last couple of hours. Travis is here to show us why. Hi, Travis.
Good morning. This photo really struck me this morning. I think it struck a lot of people. Within just a couple of hours of posting it on Reddit, it has been shared all over the place. The caption on the photo says, this is an ER doctor in Southern California who has just lost a patient, a 19-year-old patient. and this doctor has stepped outside. This is actually an EMT who has posted this on Reddit. He says that he got permission to share this photo. We decided to show it on television. You can't see this doctor's face. There's no identifier of who this doctor is or where this is. And it's far enough away that we didn't think it intruded on the personal space here, but it really is a telling story about the humanity and what doctors and those who are there to save our lives on a daily basis deal with. It's just, according to the EMT who posted this photo, he said that the doctor took this moment, was outside, and then came back into the emergency room, head held high, no tears, and went back to work saving lives.
Incredible.
It's tough to fully describe or explain. You know, they say picture's worth 1,000 words. That's why I wanted to show this particular image. It actually made me think about my dad as a cop, and I was a reporter, a street reporter. And my rookie time, we used to compare notes about some of the things that we would see, and some of them would be grisly. And I said, Dad, how do you keep your humanity after all of these years? And he said, you know, you have to go to work and do your job, basically every night and every day, but that every 6 months, you got to feel something.
Yeah.
And if you don't, that's when you're in danger of losing your humanity, and you need to figure out something else that you need to do. And I think that's what this photo really demonstrates, is the humanity that this doctor was willing to show and to experience, and that it isn't just a job for this doctor. Saving lives, and these patients are real human beings.
And it means something to him.
Absolutely. And even though this doctor has to go to work every day and deal with this kind of trauma, there are things that still touch him, obviously, and still move him.
Right.
And I think that keeps him more human.
And it's such an interesting behind the scenes, because you're right. You do see the doctors and the firefighters and the police officers who do these sometimes horrifying jobs.
Yeah.
And you do wonder, how do they get through it?
How do you continue?
Sometimes they don't.
Sometimes.
Yeah. Wow. Travis, thank you.
Thank you very much.
That's a great photo. Really powerful there. 7:56 coming up, the city of Seattle.
So, you know, just to have that on the, just going to end on that, I mean, it shows the human side to this, the profession you guys do, and how important you are, and how sometimes things happen. And, you know, even when, I think it gets back to the fact that we're all here to try for our best to try to help others, and unfortunately sometimes bad things happen, and sometimes those come with more consequences than we know. And hopefully if that does happen, we know where to get help and how to deal with that help. Anyhow, thanks for listening. I know this was a little longer than the other ones, but a couple minutes if anybody wants to share any of their experiences or anything else, or any questions, we can kind of go from there.
Absolutely. We want to turn this over to our participants. Dr. Dodson, Ballister, anybody who'd like to participate, we'd like to turn it over to you in the last couple of minutes.
Pedro, go ahead.
No, go ahead.
I just was reflecting back to, I spent 2 terms on the Oregon Board of Medical Examiners in, can you hear me okay?
Mm-hmm.
Yeah, okay. And how just everything that was said that Nelson said is absolutely true, and how devastating it is. The Oregon, in the 1980s, there was a rash of 8 physician suicides in a very short period of time related to being under board action. And it really took people aback, and had to institute some changes in administrative policy. At that time, any physician who was under administrative review by the board was immediately taken out of practice, whether they were a danger to anyone or not. And now that really only applies if it's a sexual misconduct or, you know, some other professionalism violation. So I think the things that we do, that piling on of the community that Nelson mentioned, I think is really important, and finding ways around that. I mean, we just cannot, these people are under so much damaging stress already, trying to do what we can as a community to really make sure we are supporting rather than punishing people. It was really great talk, and I think it's just really, really true.
Thank you. Yeah, I mean, it's devastating too. I think that especially when the regulatory boards can sometimes get involved and like punish people for trying their best to help somebody, and it wasn't because they were like breaking codes of ethics or they were deliberately being malicious. And it's like, why do you even get in here if you're gonna, like, this happens sometimes. I need support, I need help, not punishment. But that's one of our challenges. We deal with a lot of issues with regulatory boards. We get people getting punished for being sick, so it's a challenge.
Dr. Ballister, did you have a question?
Well, actually, a statement. You talked about the code of silence, but the fact is, the attorney's advice not to talk to anybody about a case, if it's ongoing. So you need to qualify that code of silence.
Yeah. Okay. I appreciate that feedback, and you're absolutely right. When a difficult situation like that happens, that you're right. If you expose or put yourself at risk, is that going to come back on me? And that, again, speaks to the unfortunate part of this scenario is I'm not allowed to be, everybody else can seek help when they're struggling, but we're going to kind of get this expectation where we have to be beyond our own human emotions to be able to handle this stuff and not be able to reach out because it might put me into some legal risk. And it's unfortunate, but you're absolutely right. Thanks for that feedback. I appreciate it.
Okay, well, thank you all for joining us today. We appreciate Nelson for providing such valuable insight into leading our discussion, and for our physician participants for joining our series.